Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be going over a very quick tutorial on how to stop the progression of your cervical spine degenerative disc disease. Hope you enjoy. Now, in almost 30 years of orthopedic and chiropractic practice, having a 93% success rate with cervical degenerative disc disease cases, I can tell you that the bottom line with halting or slowing down the progression of your degenerative disc problems in your neck or cervical spine is related to decreasing the stresses that are imparted to your neck. Now, most of us don't realize that stress to our neck is what initially broke down the disc, caused the facet joints, which are the joints in the back of the spine, to start the arthritic process. And those stresses actually caused breakdown usually years before you first felt pain. A long time before you had that cervical or neck MRI or X-ray or CT scan. And unless you decrease those stresses to your neck, despite surgeries, despite treatments, the stresses will continue and the progress or the deterioration of those discs will continue. So what do we mean about those stresses? Let's define that first so we can learn how to slow those down or eliminate those. Stress applied to the neck can be categorized in two different areas. One, a macro stress, such as a slip or a fall or a car accident where you have a major trauma damaging and tearing neck soft tissues such as discs, ligaments, facet capsules, muscles. Or more commonly, what most of us suffer with degenerative disc disease in terms of its root cause is a micro stress, meaning a small stress that was repeated in the neck structures that took place over many, many years. And usually, the bottom line with these micro stresses, it was some type of posture or mechanical movement issue that was not correct, that was asymmetrical, that was causing an abnormal wear and tear on those disc fibers, on that joint, on that spine. So the first thing you need to know before you talk about slowing down the progression through exercise and posture changes, which is of course the answer here to decrease those stresses, we first have to learn what are our unique posture and mechanical issues. They're going to be different for every person. Some of us have a tendency to tilt our heads slightly to one side. If you look in the mirror, you'll see your head tilted. Some of us rotate a little to one side. Some of us have a high shoulder blade. Some of us have a rounded shoulder blade. Some of us have a tipped, downward rotated, or abducted shoulder blade. Some of us lean to one side with our rib cage. Some of us have a foot or a knee that has a mechanical dysfunction. Any dysfunction in the body can pull on the interlocking fascia that connects the body and disturb these neck tissues. Most commonly, though, we have a posture problem with either our neck-head position or our shoulder blade position because the muscles and fascia from the shoulder blade directly attach into those cervical discs and vertebrae. So what I would suggest you do is before we learn any exercise to help slow down the progression, you need to make sure that you have a good full body analysis of what your unique posture and mechanical issues are. We have that available for you at both the Posture Size website and the Pain Free and Fit website. You can take a full body analysis there and learn what your unique issues are. Once you learn what those issues are, you can hold your body in a more neutral position to decrease the stress on the neck. Typically, what that neutral position includes is decreasing the tendency to have a forward head posture. Normally, the ear should be directly on top of the shoulder. When it's forward, it causes an extension and a shearing anterior translation stress on those discs. Another common problem is having a rounded shoulder blade. As I said before, either a tilted or rotated head or other dysfunction of the shoulder blade. So learn by taking that free body analysis on either of those websites what your unique posture is, what your mechanical issues are, and then we can plug them into some of these simple stretches and exercises that I'll share with you now. Stretching a few times a day helps to undo some of the fibrosis or scar tissue that we often have in our soft tissues in our neck. Typical stretches would include side tilting, twisting, ear to the front of the shoulder that targets the opposite trapezius by holding that shoulder down, tilting the chin to the front of the shoulder, keeping that shoulder down, and stretching our SCM muscle by looking to one side and up and leaning our head slightly back into the side, where you'll feel a stretch here. All stretches, of course, should be held for 15 to 60 seconds until you feel a release in the tension that you're feeling. Something to keep in mind is you're always going to be stretching usually more to the side opposite of your tightness. So if I typically have a posture where my head tilts to one side, such as the right side, or an elevated shoulder, that's tightening a lot of the structures on the right. I'm probably going to need more help stretching the opposite way. If I don't include my unique postural and mechanical corrections, my RPIs, or reverse posture isometrics, and I just try to stretch this way without properly learning how to position my shoulder blade or neck based on my unique posture and mechanical issues, I'll only be stretching to a certain amount of benefit. Many times with exercise, if we're not correcting our unique dysfunctions as individuals, we'll only be strengthening those dysfunctions. We'll want to include some strengthening exercises for the neck and shoulders. The most common strengthening exercises that will be beneficial to help you obtain a neutral cervical or neck position is head retraction. That's simply pulling the face straight back, avoiding lifting the chin up or down, and of course avoiding your postural issues of doing that, whereas you may tilt your head to one side. If you don't correct that with that head drawback, you're only going to be strengthening that dysfunction rep after rep, week after week. So you want to make sure you're in a good neutral position based on that body analysis. We want to include some isotonics or isometrics in both rotation. You can use your fingers against your cheekbone to rotate against resistance both ways. You can use your finger on top of your ear to laterally flex. And you can do that both isotonically, meaning moving through motion using the fingers for resistance, or isometrically, meaning just holding the tension. You can also lay face down, let's say on your bed or exercise bench, with your head and neck off the top of the bench and drawing the head back. We have a bunch more of these exercises on our websites and in our ebook on neck pain, as well as our online healing exercise program that really delve into the specifics in terms of reps, how frequently, sets, and how to do these great exercises. Shoulder retraction and depression are also very important. Exercises that pull the shoulder blades back towards each other. Exercises that push the shoulder blades down. You can do that sitting on the ground or an exercise bench with cables or dumbbells, reverse flies. They all help to undo the typical patterns of shoulder blade elevation and rounding that stresses the neck. So the idea here in the long run is you want to be adding a number of repetitions, increasing the resistance and the weight, and increasing the number of sets as the months and the years go on to these home rehab programs, twice a week or 3 times a week, to increase both the endurance, meaning how long you can hold these positions against gravity or an outside resistance, increasing strength, meaning increasing the amount of resistance, the weight used or the amount of tension used against, and the overall duration of doing sets and reps and the volume of your work, so that all of these exercises are helping you to hold your shoulder blade and neck in a neutral, safe position, avoiding forward head posture, shrugging, rounding, tilting, rotating, so that the discs are not getting loaded with any of these asymmetrical positions. The more you strengthen the endurance and the strength to be able to hold this over time, conditioning your neck, you'll be slowing down the progression because you'll have the proper stability with movement, with static positioning. If you're working on the computer and you've built up your repetitions of bringing that head back into the hundreds, or the endurance time of holding it back during the day for 1 or 2 hours at a time, that's going to net affect a lot less stress in your neck as you go on over the next few years, as you go on through decades. You want to make sure that you have this core stability of your neck for work with the upper extremity. If you're used to reaching up repetitively during the day and you don't have the strength to keep your shoulder blade down, your head back, what's going to happen is you're going to keep having your head moving forward, your shoulder blade coming up, because that's your typical movement tendency, and that repetition after repetition is aggravating and wearing out those neck structures. So besides conditioning your unique body posturing mechanics into a neutral neck position, you can also add nutritional aspects to slowing down the progression by increasing your water intake. A properly hydrated person is going to have a lot less inflammation. You can include an anti-inflammatory diet. That's out of the scope of this video, but again, on the Pain Free and Fit website, we have a nice description of an anti-inflammatory diet, which highlights certain foods that should be avoided and certain foods that should be included to decrease the tendency for inflammation. The more inflammation you have, the more wearing out and degeneration typically we're going to have in the body when it's chronic. Inflammation helps us when it's in a short or acute period. So I hope that you can use some of these tips to steer you towards better decisions in terms of your posture and your exercise habits, as well as your nutritional protocol to slow down the progression of your neck or cervical spine degenerative disc disease. If you have any questions, please leave them below or comments. I'll do my best to get back to you. If you like this video and would like more specific exercises of how to do things the right way to decrease your mechanical stresses and improve the stability of your neck, please subscribe to our channel. We've got lots of great neck exercises, shoulder blade exercises to rehab those areas. I hope this video series has helped you with decreasing or slowing down the progression of your cervical degenerative disc disease.